Competition Commission has filed a referral for prosecution of Swiss-based multinational healthcare company Roche for excessive pricing of a breast cancer treatment. Now, the company manufactures Trastuzumab, that's a life-saving drug which stops the development of an aggressive type of breast cancer. The referral is filed with the Competition Tribunal on the grounds that the excessive price is in violation of the right of access to healthcare. Let's unpack the story further for you. We're joined now by Bakhe Majenge, Chief Legal Counsel at the Competition Commission, who joins us via our video link this morning. Mr. Majenge, thanks very much indeed for your time. Sure, an incredibly worrying and disturbing story this. According to the information that we have here from the Competition Commission, it estimates 10,000 breast cancer patients were unable to get this life-saving treatment because of this excessive pricing.
It's correct. Morning to you and to your viewers. Essentially, the Commission found that between 2011 and 2020, in the private sector, the cost of Trastuzumab was approximately 400,000. And in the public sector, we found that the cost was about 160,000. And our findings show that if prices were at a reasonable range or level, more people would have been able to access treatment.
I wonder whether the Competition Commission and its research goes as far as to unpack that number. You know, those 10,000 people who couldn't access this treatment between 2011 and 2019. I mean, can you make a connection between how many of those people died because they couldn't access this life-saving treatment?
Indeed, our findings do reveal that at least 10,000 patients would have been able to access treatment had it not been for, unfortunately, the unaffordable and excessive prices for this drug. But our investigation did not go as far as to ascertain out of the 10,000 how many of those were deceased.
Yeah. I mean, you are with the Competition Commission and you're not in the healthcare profession, but I just want to give our viewers a sense of this drug and what it does. Trastuzumab, according to the information that we have here, a first-line treatment, life-saving drug which stops the development of an aggressive type of breast cancer called human epidermal growth factor receptor 2 positive breast cancer. It's HER2+. That's the type of breast cancer. It stops the development of these tumor cells from going any further. In terms of the Competition Commission's research into this issue, how far did you go in terms of talking to healthcare professionals, talking to hospitals, and what they told you about, you know, if they had more access, if their patients had access to this drug, how their journey in terms of cancer would have been different?
We can confirm that we did consult with experts in the field and oncologists who have confirmed that this drug is efficacious and quite critical to cancer treatment. As you have correctly pointed out, HER2+, unfortunately, is a very aggressive form of breast cancer. And early treatment and early access to treatment is quite critical. And that is where price then plays a very big role in terms of enabling access to treatment.
What do we read into this this huge difference in terms of pricing in the public and the private sector? You were telling us it's 400,000 rand in the private sector, 160,000 rand in the public sector.
Essentially, the difference is that in the public sector, the drug is sold under the brand name Hethlon. And of course, pricing, as you know, is a function of negotiations. In this case, it would have been negotiations between the Department of Health as well as the drug manufacturer. And in the private sector, what we found was that even insured patients, unfortunately, were subject to a very high co-payments. in fact, before March 2019, Herceptin was not a prescribed minimum benefit.
Sure.
It only became a prescribed minimum benefit after March 2019, and it was only available then to those scheme members who had comprehensive cover.
Yeah, in fact, that was my next question to you, because when we think about who this kind of excessive pricing would have affected the most, it would have been poorer South Africans who would not have been able to pay for this kind of life-saving treatment. And as you say, even those minority of women who had medical aid, there would have been that massive co-payment as well.
That is absolutely correct, and you are absolutely right. Unfortunately, the burden of disease in this case falls obviously on women, which is really quite sad. Hence, we have made it clear in our papers that constitutional rights are also implicated, including the right of access to health care.
You know, this is what I want to ask you as we wrap up our interview, Mr. Majenge. The Commission has asked the tribunal to impose a maximum penalty against Roche for its alleged harmful and life-denying pricing conduct. What kind of penalty would that be when we take into consideration the amount of people who you can no doubt make the connection between receiving this treatment, not having access to this treatment, and dying?
Yes, we are looking for the maximum penalty that the tribunal can impose, which is 10% of the turnover of the firms, bearing in mind that we are dealing here with a multinational firm. So we'll also be looking for the turnover of the holding company, which is Switzerland-based. So we are really looking at a penalty in a region of some millions. Of course, the actual calculation of the penalty will be done at a later stage.
Bakhe Majenge, let me thank you for your time this morning. Chief Legal Counsel for the Competition Commission. This is certainly a story on our radar. Excessive pricing, alleged excessive pricing by the Swiss-based multinational healthcare company Roche. 10,000 women suffering from breast cancer unable to access this life-saving treatment because of this alleged excessive pricing.